Try not to touch your ouchie. Oh,
Sorry.
sorry.
Come look at this. Look this way. You ready? Alexa, wall off. Alexa, wall on. Alexa, wall on. It's like magic. So I finally got her hooked up.
That's cool.
Okay, now that's the last time.
That's all he's been doing all morning. He's actually just been sitting on a stool beside Alexa, just telling her to do wall off and wall on.
Over the weekend, we were at the Airdrie Pet Expo, the first Airdrie Pet Expo. We spent a cumulative 12 hours there over the weekend, just giving pets lots of treats. My hands still smell like liver.
I think it was like stuck under my nails too. This one is Carling's recheck from a dog she saw last week was attacked by another dog. So I think it's just part of the wound wasn't viable, like part of the tissue from when we repaired it the first time. So I think she's gonna go in and try
Cue pictures from Carling's Instagram now.
I think she's gonna go in and try and revise it. I've got a spay that hopefully Carling and Renee will help me out with. This is my first mature dog spay.
Oh,
Yeah.
for sure. No pressure with a camera
It's
on.
barely mature.
I know. I was expecting this like
It's a
obese
year old.
lab.
I was
Yeah.
like, it's not even mature. It's still a puppy.
It's a fake mature
I don't know
spay, but
that's
You can say, I completed my first
done my first mature dog
mature spay today.
it's scary, but it's nice having such a great group of people who are so supportive. My work fam is amazing.
So Cody knew that he needed experience over anything when he hired his first people. Yeah.
Which I agree with. Like,
Yeah,
I
it's-
can't imagine if I had been the first and only like senior vet.
Yeah.
Coming in would be.
It wouldn't be fair. at all.
No. And it's kind of like a lose-lose because in order to get a good learning experience, you need to be in an environment where like people aren't figuring out how to run the day-to-day, right?
Yeah.
I think that was probably the bigger part of it.
But thankfully we are at a place now where newer grads can come along. There is enough mentorship and support that we can support that and hopefully not burn anybody out in the process.
Yeah.
An older dog was in this morning for a heart ultrasound because he had a heart murmur. Ideally, we would want to do the heart ultrasound, get the results back, and then move on to the dental. However, the owners wanted to do everything all in one shot. So we anesthetized the patient for the heart ultrasound and then moved on to our dental extractions. This dog did have some pretty rotten teeth, so we did do a full mouth extraction on him.
Oh, hello.
Do you want to come video the chunks?
This is a little calculus and tartar. It stinks. There's pus in here. And hair. So that's the tooth underneath it all. It's just over time, all the plaque turns into the hard calculus. It's bacteria, saliva, hardening up. Just cakes on and then builds on top of itself over time. I've seen worse, but it's a pretty bad one. Super satisfying, it just smells really bad. The ginger and the bone should be up to this line here. So this is all recession. This is mobile like crazy. So is this one.
So I'm gonna just do everything that I normally do. Make really big flaps for everything still, so that I can try to close things. The gum is like very infected, so it's just, yeah, it's a lot. A lot of bleeding. I mean gums, but the gums are so inflamed and infected that that's why. There's not really much, like the bone, like the infection has even ate away the bone. So there's not much bone left even. For sure gonna be a oral nasal fistula. So usually if you're taking out the top canine and there's like this much bone loss, it usually connects to the nose. So that's why the nose is bleeding. So we'll start this dog on antibiotics. I was looking at this cute picture of my dog.
Oh.
That Bree posted. She's so derpy. This one looks so derpy though.
There.
It's so funny. We have one more quadrant of these disgusting teeth, but they might just come out. Even just waking up from anesthetic, sometimes they're like instantly happier. I can just imagine, like every time they move their mouth, teeth are moving, there's like pus coming out of places, like not nice. This dog's mouth literally smells like it just ate horse. He has no teeth left in his mouth, but definitely should be feeling a lot better. He did have bilateral oral nasal fistulas that communicated with the canines after removal. So this is a small hole between the oral cavity and the nasal cavity. So we did for sure want to put on some antibiotics for a while after surgery to make sure that we don't get any infection.
Now I've got a question for you.
This is sensory, but it just seems really vascular here. But if I try to go further down, I feel like it's just a bunch of little blood vessels. I feel like this is the pedicle in here. But if I break this, is that...
Where's your ovary?
Right here.
Okay, just don't break it.
Don't break the sensory.
Yeah, like you have enough exteriorization.
Okay.
So I would just like clamp across and just tie it all.
Oh, okay.
Yeah. Like I don't break them every time just because I have enough. When I have enough exposure, then I don't risk like.
So make it like
bleed more.
here.
Pull it up a little bit more. I would go like. See that where your thumb is? There's that big vessel. I would go there.
Like here.
Yeah, clamp across.
So make a window here.
Yeah.
Cool.
You're welcome.
Thank you. I appreciate having people to ask those types of questions too. It's also nice not having any pressure. Everything looks great. I'm gonna quadruple check it.
I started off the morning by doing a recheck on an attack dog that I saw last week. The dog was attacked by 2 other dogs and had some pretty nasty lacerations. This is healing really nicely. This is healing really nicely here. It's just that flap in the middle died, which we were worried about. Like it's just kind of a risk. Like sometimes it'll live and like the blood supply will come back, and sometimes it won't live and then it'll die, and we just have to debride it. So I'm just gonna take out all these stitches that we had in before. I'm gonna just remove all this dead tissue to try to get rid of it, because obviously it's acting now as a foreign object for infection. There's lots of infection here. So she'll continue on antibiotics, and now it'll just heal via what we'd call second intention healing. So the body will slowly make a nice scab or area of granulation tissue over top of this fresh tissue, and then the skin will slowly form over top of it until it heals. Second intention healing just takes a lot longer than primary, so when you have the stitches there, they heal nicer, a little bit more cosmetic. There'll be a bit more of a scar here, but you won't be able to see it once the hair grows back in.
What kind of state was this little guy in when she came in?
Pretty good, actually. She was really stable, just like in a lot of pain. Shocky, a little shocky. So we just like got pain meds on board, hooked up to IV fluids, gave an IV bolus to maintain blood pressure, and then started getting to work on trying to close this all. It took like, I'm a relatively fast surgeon, but it still took almost an hour of just surgical time to just close it. There was a lot of piecing. It was like a puzzle. It was attacked by dogs. The skin was all ripped open. The other thing though too is that dog bite wounds are nasty, dirty, and then they have high risk of getting infected, but then they also are crushing injuries. So just from the trauma, from the crush, skin can die because of that too. I'm just trying to remove all the pus, the dead. We'll clean it really good. I just debride till there's blood, because if it's bleeding, then I know that there's blood supply and it's alive. So that's why I'm cutting off the edges to make sure that things are bleeding appropriately. Just gonna re-put a drain in this, because it's still, or do you think I should just tack it down?
I think you have much more experience than I do. So whatever feels right in your gut, I think is probably the right thing to do.
A drain?
Yeah.
And people always think the drain drains things. These drains just keep it open so that it will drain. Does that make sense?
Yeah.
Like it keeps the skin hole open.
So there's nothing actually coming out of the drain.
Yeah, like the stuff oozes around the drain. So this way, because there was that like a pouch here. So like if you look, like my needle drivers can go like quite far down into here. So now when she's standing, it'll drain out of this instead of creating a pocket. Now we're gonna manage it as an open wound and put Manuka honey on to try to keep away infection and encourage granulation tissue. The dog is still on pain medication and antibiotics, and we're gonna recheck her on Friday to pull the drain that I placed and make sure that everything is healing well. While all this was going on, Mel was busy doing a mature spay. Everything went really, really smoothly, which is not surprising because Mel is amazing. And Cody was working on another trauma dog that we saw last week.
So this is Pistol. Pistol is a ranch dog. And last week he got in a fight with his son, and his son won. So he got his whole neck ripped up, all this tissue was loose and hanging, he had multiple puncture wounds all over, and his whole neck was ripped up, and then also in his leg was ripped up too. Oh my goodness, yesterday Emerson was just like, went full kickboxing towards me, and I thought like I would have till he's 16, and I think I have till he's like 9 before he just whoops my butt.
How old is he?
8.
So you have 1 year?
Right?
Yeah. So bite wounds are always inherently infected. So we put drains in just to drain all that nastiness out. So we're just seeing whether or not we need to pull his drains or if we should leave them a little bit longer. Overall, it looks really good.
What was his state when he came
Oh,
in?
just destroyed. He so lethargic and painful, and his whole front end was open right up. So it was really nasty. So we're just assessing the wound, seeing how much infection there is all around. He's gonna have a lot of scar tissue, but overall it looks better than any of us expected. He's a warrior. I cannot believe how well Mel did.
Yeah, it's healing beautifully.
Everything was great. Is he still on antibiotics?
Should be.
And from a pain perspective, he looks great now.
Good compared to Friday.
Yeah.
I would try to pull that, Cody, right now.
Okay.
Like and see like where it is coming from.
Okay. Like pull it up and see.
Yeah.
So this is where he was ripped up here as well. This is a drain that was put into place just to help get some of that infected fluid out. The drain hole was here and it was just barely sticking out, so I've cut the suture material here and the suture material here. So this is what it looks like when a drain placement comes out. Those holes will just heal because they are slightly infected. Those, we don't want to close those up. So they'll just heal up pretty quickly, but we don't want to, if we suture them closed, then we'll trap infection. So we'll leave those ones open. Now this one is still draining quite a bit of material, so we're gonna leave this one intact still and get them to pull the drain in 2 more days. Be free, my old friend. Be free. He looks like a wounded African wild dog.
He does.
Who just battled with a hyena.
And to round off the morning, Dr. Zook did a lump removal.
I swear, Cody, you got into the wrong career. You love cleaning way too much.
Diana would not agree with that statement.
So I don't really believe in just cutting masses off because you can't see the cancerous tissue underneath the mass or to the side of the mass with your naked eye necessarily. So every time we do a mass removal, we're going to take a small portion of normal tissue around it to try and decrease the chance that we left some behind. Okay, and Lauren blocked it for me, so there should be less pain in this area. So we're going to go ahead and get rolling. And start by creating an incision around the bit we want to take off. And because it's the face, it's going to bleed a lot. So it should actually heal very nicely, but it makes the procedure a little more difficult because you can't see as well. It's probably benign, but any sort of abnormal growth of tissues is theoretically cancer or an overgrowth of cells. Some cancers are benign, meaning they're not scary, they're not going to spread to other parts of the body. This could also be a non-cancerous lesion, though. It could be a papilloma virus lesion, too. Where they'll also get overgrowth of cells in association with that virus. But it's kind of odd to only have one. And he's fairly old. He's about a year old. That's fairly old to have papilloma. Not that it can't happen, but I don't think it's that simple. But I could be wrong, absolutely. And unfortunately, the owner does not want to send it away, so we're not going to get an answer on what it was. So my job is just to remove all the tissue so that we don't have a high chance of it coming back again. So this owner had mentioned that if it comes back again or he develops future masses, then yeah, she would consider. But for this first one, she just wants it gone. So these little sutures I'm putting in here are going to come out in about 2 weeks. He's going to be in a cone because he's going to want to rub his little face on everything because this will be itchy for him. And then we're likely going to send him with a little bit of antibiotic. And after a couple weeks, he'll come back and we'll try and remove these sutures. So while he's sedated, it's just a good opportunity to check other things that we didn't get a great assessment on with him awake. Yeah, I'm going to check for a cranial drawer. It's on my list of 10 things to do. He's got some mobility issues, and those have been there for a little while. I think they just haven't been convincingly diagnosed yet, so he's actually going to see an orthopedic surgeon at the end of October. I think he needs a lot of treatment. Once he gets it, it should be very positive for him. But he's a possible allergy dog. We need to get the knees dealt with. And once we get that stuff under control, there also might be some kidney issues that we've got to deal with too. So time will tell, but he's going to be a more involved case than average.